Biology Part 81, Blood Groups and Transplantation. Blood grouping is based on the occurrence of a number of substances fixed to the membranes of red blood cells. These substances may act as antigens in the event of blood transfusion from one individual to another. The most important examples are the glycolipid ABO antigens, as outlined in the figure, of course. A person whose red blood cells carry only A antigen is said to have blood type A. Individuals with B antigens only have a blood type B, while those with both A and B antigens have blood type AB. If the red blood cells carry neither A or B, they neither carry A nor B antigens, the person's blood type is O type. In each case, the blood plasma contains antibodies against the blood type antigens which are not present. For example, type A blood contains anti-B antibodies, and type B contains anti-A antigens. Type AB has neither of the antibodies, and type O contains anti-A and anti-B, and O contains both anti-A and anti-B. Surprisingly, the production of anti-A and anti-B antibodies are genetically determined and not depend on the exposure of antigens. The reason for their presence is not known. The consequences of this arrangement for blood transfusions are summarized in table 9.1. Well, patient's blood group A has antibodies present of anti-B, and blood groups which may be used for transfusion are A or O. The patient's blood group of B has anti-A antibodies, and blood group for transfusion are B or O. And the patient's blood group AB has no antibodies, and it is good for the blood groups transfusion of AB or O. And for patient's blood group O, the antibodies are anti-A bodies and anti-B antibodies, and blood groups which may be used for transfusion are O. Well, if blood of an inappropriate type is given, for example, if type B blood is transfused to a type B person, there is an immediate reaction in which the antibodies of the recipient blood attack the red cells of the donor. This causes the red blood cells to agglutinate, and that is to stick together clumps, in resulting the blocked blood vessels, kidney damage, or even death. The parallel reaction in which the donor antibodies attack the recipient's red cells also occur, but the number of antibody molecules transferred is so small that this effect cannot be neglected. Can be neglected. I beg your pardon, please. The antibody molecules transferred is so small that this effect can be neglected. I beg your pardon, please. In practice, blood of the matching type is always used for transfusion, must be matched not only for ABO group but also for RH or rhesus type. The rhesus factor, first discovered in the blood rhesus monkeys, is another antigen and which may be present in the membrane of the red cells. An individual possessing the antigens is said to be rhesus positive, RH positive, while the person who lacks the antigen is rhesus negative, RH negative. In the UK, 85% of the population are RH plus. Exposure of RH plus blood causes RH negative person to produce anti-Rh antibodies. This can occur during the pregnancy of Rh mother, Rh negative mother with an Rh plus fetus.